Hey, welcome to the next installment of our Data for Nutrition webinar series. I both want to welcome those who are listening live. We're glad to have you, as well as those who are checking out the recording. As we know, people are in all different time zones and trying to access these materials at different times. Today's webinar is actually another installment in a series that we've been doing around visualizing nutrition data for decision making. Today we're going to talk about how can the nutrition community use the Global Fortification Data Exchange tool. So just a couple guidelines before we start. I think people are pretty familiar with the Zoom platform at this point, but we would like to know that all participant videos and microphones are muted during presentations. We don't use video because we want to try to keep the streaming quality as high as possible. We ask that anytime during the presentation, you go ahead and use the Q&A button at the bottom of your screen to submit questions for the panelists and the presenters. We're going to get to as many questions as we can when we get to the Q&A time. And also, just so that you know that a recording of this webinar will be available on the Data for Nutrition YouTube channel immediately, and then presentations and a Q&A summary will be posted in the community in the coming week. If you have any trouble at any time, please go ahead and go to your chat. So this is not the Q&A, but the chat box, and select Riley Hour on the 2, and she will do her best to respond to any technical issues during the webinar. So the Data for Nutrition community of practice, our goal is to provide members with opportunities to share knowledge, experience, and questions relevant to strengthening nutrition data value chain at all levels so that we can achieve better nutritional outcomes in low and middle income countries. We're excited to say that since we launched officially at the start of the year, we have more than 700 members and continue to grow. My name is Rebecca Heitkamp. I'm an associate scientist at the Johns Hopkins Bloomberg School of Public Health, and I'm your moderator today, just providing this background, and I'll be back at the end of the webinar to wrap up. I'd like to introduce you to our speakers today. We'd like you to have an image of them, even if you won't be seeing them on video. We have 2 colleagues who are who will be presenting today. So Florencia Vasta is a member of the Global Fortification Data Exchange Secretariat. She works as a senior associate at GAIN, and her involvement in around the area of fortification includes improving data collection tools and data systems for decision-making at country and regional level. She works on private-public partnerships and cross-sector partnerships, as well as country and regional technical support for fortification programs in Asia and Africa. Becky Tsang is the project manager for the Global Fortification Data Exchange Secretariat, and she's a technical officer at the Food Fortification Institute and the project coordinator at the Global Iodine Network. And across these roles, Becky's involved in landscape analyses to identify opportunities for fortification, providing technical support to governors and partners in planning, implementing, and evaluating cereal grain fortification, and systematic evidence reviews on food fortification. So we're excited to have 2 speakers who are very well versed in the area of food fortification, but also very involved in the tool that they're presenting today.
Great, thanks so much, Rebecca. Hi, everyone, this is Florencia here. First off, I just wanted to say thanks so much to everybody for making the time today for this Data for Nutrition webinar on the GFDx, which is a platform to visualize data, and we're really excited to share it with you. So first, I'll give you a bit of background on the GFDx, walk you through some of its features and the type of data and visualizations we have. Then I'll take you through the website, and Becky will do a quick role play to show you how a nutrition stakeholder might actually use this platform in a real-life example. So to begin, I'll set the context here with what is large-scale food fortification. So according to the WHO, more than 2 billion people worldwide suffer from micronutrient deficiencies because they don't consume enough essential vitamins and minerals in their daily diets. This is a major global public health problem that can affect people in all age groups in both industrialized and developing countries. In fact, it may be hard to remember, but there was a time in which conditions such as goiter, rickets, scurvy, beriberi, vitamin A deficiencies, and pellagra were once common in countries like the US or countries in Europe back in the early 20th century. But today, these are largely rare due to many decades of food fortification programs, as well as other interventions such as dietary diversity. But there are still foods fortified in these countries and regions to prevent health conditions like neural tube defects in children, which can result from folic acid deficiency in mothers during pregnancy or even before a woman becomes pregnant. So food fortification is a cost-effective, safe intervention and requires little to no behavior change. Since the vitamins and minerals are added directly by food producers to the staple foods that are commonly consumed by most of the population. This can be flours or cooking oils, table salt, etc. The intervention can be scaled up and can be really sustainable at a low cost. So the Global Fortification Data Exchange platform, or as we'll call it, the GFDx, was actually an effort that responded to a major challenge raised by the fortification community. During the first global summit on food fortification in Arusha, which I believe many of you probably attended, governments, NGOs, civil society, donors, and researchers all came together to align on a common fortification agenda for the next 5 years. As they were discussing the importance of the data, they came to the realization that a lot of different stakeholders collected and housed fortification data in many different ways and in many different places. So there really was no one-stop shop for data on fortification globally. So as more countries during this Arusha summit committed to adopting food fortification programs and legislation, stakeholders raised a call for better accessibility to inform policy, identify populations in need of fortification programming, and to measure global progress. And this need was formalized as a call to action in the 2015 Arusha Statement on Food Fortification. As a response, several organizations came together to create this platform, the GFDx, and it's funded by the Bill and Melinda Gates Foundation. So some of the organizations that are in the GFDx Secretariat that have built this platform are GAIN, Iodine Global Network, and Food Fortification Initiative, and in close collaboration with the Micronutrient Forum. So the GFDx is an interactive visualization tool to empower the global fortification community to make data-driven decisions on food fortification policies and programs. The data can be downloaded for analyses or can be used directly on the site to make your own customized maps. So where does the data come from? All data from the GFDx come from countries themselves and national programs. The GFDx does not go and collect this data ourselves. In fact, every 2 years, we come out with a survey of questions for countries asking for their fortification data if they're able to publicly share and contribute it to the GFDx site. So we contact different ministries responsible for fortification, different NGOs in the country with programs in fortification, and others that may gather the national data. And so consolidating available data for different foods allows national decision makers to actually more holistically and comprehensively view their fortification programs, identify gaps that still exist, and make comparisons across foods and between countries, and for the fortification community to track this global progress, as we had promised in Arusha. So the GFDx not only provides data and visualizations on fortification, but it's also a platform with a lot of resources for users and fortification stakeholders or nutrition stakeholders largely, like fortification during COVID, links for premix suppliers, fortification guidelines and best practices, and resources for advocacy and more. So we have a media center as well to display publications or articles that have used the GFDx data or cited the GFDx. And we also have an events page that features upcoming webinars, meetings, and other events on fortification or on topics around micronutrients generally. And finally, we've developed a number of documents using the GFDx data, such as policy briefs, which you'll see here, and they'll be up on the site at the end of the year. So what type of data does the GFDx house? Currently, we have data for 196 countries on 5 of the most commonly fortified foods. These are maize flour, oil, rice, salt, and wheat flour. The type of data we compile can be organized into 3 broad categories. The first is foundational documents. These are documents to establish a good foundation for a country's fortification program. The second is fortification potential or opportunity, which include indicators that provide information to determine the fortification potential of a food in a country. And then the third category is program performance. And this includes indicators that give users information to determine and assess how well a fortification program is performing in their country. So here are the indicators that are in the GFDx by category. In 2017, we released data globally on 3 indicators: legislation, standards, and food intake and availability. Last year, we added to the GFDx several indicators like the presence of regulatory monitoring protocols, actual data on fortification quality and compliance, population coverage of fortified foods, and legislative scope and percent of a food vehicle industrially processed in a country. And this month, we recently launched new visualizations. They're shown here with this new red flag, such as health impact indicators, which shows the impact of fortification on nutrient status in a population, as well as analytical indicators that are based on our own analyses of GFDx data, such as programmatic quality, expected nutrient contribution of the fortified food, alignment with WHO recommendations for nutrients and for compounds, and alignment with legislative standards and monitoring best practices. Great, so now I'll give a demonstration of the GFDx on the website directly, which is fortificationdata.org. And after that, Becky will help me walk through a simulation scenario, and she'll have to use the GFDx in this example to help her with a project that she's working on. So as you can see, here is the GFDx website landing page. You can see this little flag that we've newly integrated for COVID resources for fortification. But here along this header, you have multiple options. So the About Us section gives you an introduction on the GFDx, about fortification, who we are. It allows you an option to share your data if you're a nutrition or fortification stakeholder, and a contact form if you have any questions. We also have a tab here for the countries that are included in the GFDx, which I'll show you in a bit. And then under data, you can see the country dashboards, visualizations, and then you can also here download full data sets for your own analyses offline. Here you can see our methodology for harmonizing the indicators, and you can also see a list of the data contributors that we have on the GFDx. We have this media center that I mentioned before, which shows you the data in action, and again, data contributors. And then resources are the fortification resources I mentioned also. Here you can see how to use the GFDx and frequently asked questions. And then we've also got a newsletter, which we'd love for you to subscribe to. So first, what I'll do is I will go to the countries tab, and this will show you a list of all the countries that we have for the GFDx organized by region. And so if you were to click on one of these countries, you would see that, for instance, for Bangladesh, it will actually take you to the Bangladesh fortification dashboard. And so this dashboard shows you all the data that is housed on the GFDx organized by the food vehicle. So indicators like fortification legislation status, we'll use oil as an example. It shows you the legislation scope, nutrient levels and compounds that are in their standards. It shows you the proportion of industrially processed oil, the grams per capita per day, so intake, and then also things like monitoring protocols, quality compliance data. And so for each of the vehicles, you have all of the data here. I will take you now to the data. So to look at the visualizations. So this is where you can see a number of the maps, charts, and other visualizations. And so you'll click over here to this left tab, and you'll see all those indicators organized in the 3 broad categories that I mentioned before: fortification opportunity, and these are the indicators that exist, and these are the visualizations that we have. And so, for instance, for foundational documents, you can take a look at legislation status and check out our map for fortification legislation. And so this will show you how legislation looks globally. And so on this right-hand side, you can filter by income status, filter by region, by indicators. So we can select mandatory and voluntary to show us the countries that have both mandatory and voluntary legislation, just mandatory or just voluntary. So here I'll click mandatory fortification, and then you can look by vehicle. And so we can look at SALT. And as you hover over a country, you can see the various details of the data that we have for that indicator. Great. So now what I'll do is I'll let Becky walk us through an example of using the GFDx in an actual real life setting. And always know that to go back to the main page, you can always click on our Global Fortification Data Exchange logo there. So Becky, over to you.
Thanks, Florencia. Thanks for that great overview. And thank you again to Riley and Rebecca for having us. Really glad to have everyone here and joining us. And we're looking forward to taking some more questions later on. But yes, I wanted to walk you all through how to use the website using a specific example in mind. And as Rebecca had mentioned, I am the technical officer for food fortification in the Asia Pacific region. So I'm going to pretend that I'm talking to a colleague at the World Food Program that has just, moved to a post in the region, and she might be wanting to learn a little bit more about food fortification in the country that she's working in. So in this scenario, I've learned that WFP has a new country representative for Bangladesh. Her name is Dr. Maria. She's originally from Spain, and she's asking me for a briefing on fortification in the country. But, it's been a few years since I've been in Bangladesh, so I'm going to go to the GFDx to understand, where they're at right now, refresh myself and also Dr. Maria on what the situation is in Bangladesh. So before I have this Zoom meeting with Dr. Maria, I'm going to go to the country fortification dashboard on the GFDx site, because this is where I can go look at all of the information around food fortification on one country. This gives me a high-level overview of what's going on in Bangladesh rather than globally across all countries. So just scrolling across the dashboard, first I will navigate over to Bangladesh by searching in the search bar. There you go. And then by scrolling on the dashboard, I can quickly see that there's low potential for maize flour fortification, given the low grams per capita per day available for human consumption. In fact, I can also see that there's no legislation or standards for maize flour fortification. An estimated 0% of the maize flour is industrially processed, and there's no information on the coverage of fortified maize flour, the coverage of maize flour. So I don't think I'm going to give very much attention to maize flour in my discussion with Dr. Maria. If I scroll farther, when I look at oil, I do see that Bangladesh has mandatory fortification of oil since 2011. The oil purchased by households and used to produce processed foods needs to be fortified. So that's good to know what fortification legislation applies to. So that means that only a subset of the oil needs to be fortified. I'm interested in, well, what kind of subset needs to be fortified. So I click on legislation scope for oil in Bangladesh to learn more. I'm going to navigate over to Bangladesh. And when I hover over the circle under only certain types required for Bangladesh, it states that all oil produced for human consumption must be fortified, except for mustard oil, coconut oil, olive oil, and others. So that means, in my interpretation, that means that most of the population probably consumes the other types of oil that must be fortified, such as soybean, palm, and palm olein oil. But I'll check with Dr. Maria in case, maybe they've left out a major type of oil that people commonly use, and that should be fortified. Now I'm going to go back to the country dashboard to learn more about oil. Under nutrients and oil fortification standard in Bangladesh, I can see that the oil must be fortified with 22.5 milligrams per kilogram of vitamin A. Oil is a good vehicle for other fat-soluble vitamins, and I'm wondering if there's any evidence of deficient intakes in vitamin D or E in Bangladesh. Because if there is, it could be an option to also fortify oil with either of those nutrients. So I kind of take that in my head also to talk to Dr. Maria about if there's any data on vitamin D or E deficiency. So below that, I see that an estimated 52% of oil is industrially processed. So, I understand that, industrial processing means that a food is easier to fortify or more easily implemented by the industry. So this tells me that half of the oil has the potential to be fortified and half does not. So I'm wondering if, there's currently a shift towards consolidation in the oil industry, if there's any movements towards, a greater proportion of that oil being produced by the industrial players. So that might help lead to a greater proportion that's industrially processed and that can be fortified. So I think I'll also make a note to myself to talk to Dr. Maria about if we can get more information about the industry in Bangladesh. Under presence of monitoring protocols for oil fortification in Bangladesh, I see yes next to the external monitoring of domestic production and import monitoring of imported food. So that's good to know. They have protocols for both of those activities. I'm going to click on the presence of monitoring protocols for oil fortification in Bangladesh to learn more. So when I look at Bangladesh, I can type Bangladesh into the search bar. And I'm also going to make sure that I've selected oil as the food vehicle on the right-hand side. Great. And when I hover over Bangladesh, I can see that the same document from the Bangladesh Standard and Testing Institute has the information on how to conduct monitoring of domestically produced oil and imported oil. BSTI seems to be a key partner in the fortification of oil, so I'll be sure to mention this to Dr. Maria. I also see that there's an option to look at a table view of the data, so I'm going to go over to the table view and see if that provides a little bit more information. Okay. What about the data view? Is there more information in the data view, I wonder? Oh, okay. So looking at Bangladesh, I'm going to scroll to the right. Okay, there is the exact source for the information. Okay, great. Good. Now I have the document that I can cite for Dr. Maria in case she wants to bring it to her government counterparts and see what specifically that document says. Great. All right. So under oil fortification with quality compliance in Bangladesh, so I'm going to move back to the dashboard. And under the oil fortification with quality and compliance in Bangladesh, I can see that 61% of oil in Bangladesh is fortified. And it looks like from the citation that this is based on a 2017 GAIN report. And I'm wondering if the denominator is all oil in the country or only industrially processed oil. So I'm going to click on that link for that quality compliance information to learn more. All right. So on the right-hand side of the screen, I see that Bangladesh has already been selected. So I'm going to scroll down, I'm going to look at the view, the table view, or the data view below the map, and start to read the comment section. So I'm going to scroll all the way to the right. I'm going to expand on that comment, and I can see that the first sentence tells me that the 61% statistic, the 41%, statistic refers to packaged or industrially processed oil. So 41% of industrially processed oil is fortified in Bangladesh. If not all oil is being fortified, I wonder how much fortification is contributing to vitamin A intake. So it does seem like some, if not all, is being fortified. So what I'm going to do next is I've just heard that GFDx has released new visualizations that also estimate the potential nutrient intake through fortification. So I'm going to navigate over to that new visualization. I think it's under, what if I come, yes, program performance, and then potential nutrient contribution from fortification. Yes, that's what I would like to look at. And what I'm going to do when the page lands is I'm going to search for Bangladesh, click on the country so I can select it. Oh, sorry, I forgot to choose oil. Choose oil. And it's set on vitamin A. Great. I'm going to double click on Bangladesh so it gets selected. And then I'm going to look at the data in chart view, since I'm just focused on Bangladesh. And I can see that in Bangladesh, if 100% of the oil is being fortified, oil fortification is estimated to provide 0.44 milligrams per day of vitamin A, which is 88.9% of the estimated average requirement, and looks like 14.8% of the upper tolerable level. But I know from the previous visualization that not all oil is being fortified. So I'm going to adjust the analysis to take into consideration the proportion of oil that is industrially produced and fortified. So I'm going to click on that after adjustment, and I see that there's also a little information icon. So I wonder what that says. Okay, great. So it's telling me that this data is now accounting for the percentage of the food that is industrially processed and the percent of the food that is fortified, which is compliance and quality. So I can see here now that definitely the numbers went down. So now I can see that the intake per day of vitamin A is 0.14, whereas previously it was 0.44. And now the EAR contribution is 28%, whereas previously it was 88%. So I definitely want to bring this up with Dr. Maria because we can see that the lower levels of compliance and also industrial processing are hindering the program in vitamin A in Bangladesh. So I'm going to bring that up with Dr. Mia in case that she can identify any support with the industry that can help raise this number to 100%. So in terms of nutrient levels, I'm also curious whether the current standard of Bangladesh is meeting the WHO recommendation. So I'm going to navigate over to foundational documents, fortification standards, and then there I can see whether the standards are in alignment with the WHO recommendations. Let's look at the nutrient compounds. I'm curious about that. All right, so I'm going to click then again on oil as the food vehicle. Oh, I'm sorry. Oh, I've forgotten on the dashboard that they don't have, oh, I wonder why oil is not included. Okay, so, oh, I see, there's no WHO recommendations for oil. Okay, so that makes sense then. There is going to be no information on oil on the website for this specific visualization. Great, so I'm gonna go back to the dashboard then. All right, so I'm going to look down farther at the other foods included on the dashboard, and I can see that there is voluntary fortification of rice. Given that 60% is industrially processed, and a large amount is available for human consumption. Wow, over 700 grams per day. It seems like a really good vehicle for delivering nutrients. I can see on the right-hand side that currently only 2% of the rice is being fortified under this voluntary fortification scenario. So I'd like to learn a little bit more about, what obstacles are supporting, if there are any, moving to support mandatory rice fortification in the country, if they just want to stay at voluntary. So I'd like to talk about that further with Dr. Maria. Below rice on the country dashboard is salt. Since it looks like 1989, the country has had a legislative mandate to fortify with iodine. Okay, that's good. On the right, we see that 97% of the salt in Bangladesh is fortified. So it seems like salt is pretty successful. Well, I do know that salt has WHO recommendations or guidelines. So I'm going to go over to that visualization, see if I can compare that then to the WHO recommendations. So I think I already had it pulled up. Great. So I'm going to pull over then to salt in the filter. Perfect. And I'm going to search for Bangladesh. Great. Okay. All right. So now when I look at Bangladesh, I can see that there are there's three compounds that are included in the standard. WHO only recommends 2, so it looks like there are both recommended and non-recommended compounds. So I'm going to make note to talk to Dr. Maria about, should we be concerned about calcium iodate? Do food processors use potassium iodate and potassium iodine primarily? So just noting in my head that there's one compound that is not recommended. I'm now curious about whether Bangladesh follows the nutrient levels for fortification of salt. So I'm going to go over again to foundational documents, standards, and then go down all the way to the bottom where the viz is on nutrient levels. All right, so I'm going to then again go over to salt in Bangladesh. Great, and hovering over this, I can see that in terms of the levels, the Bangladesh standard requires 35 milligrams per kilogram, and the maximum of the WHO recommended range is 29, almost 30 milligrams per kilogram. So it sounds like it's pretty much in alignment. It's slightly over, 120% over, and it doesn't appear that it seems that the standards are in close alignment. So that's good to know. I'm going to shift back to the dashboard to look at the last food that is on the dashboard, and that's wheat flour. And like rice, it looks like producers can voluntarily fortify wheat flour. Almost 80% of the flour is produced in industrial mills. I'm going to scroll down to look at that number. Almost 80% good is processed in large mills. So that would facilitate large-scale fortification. The number available for human consumption, however, is only about 50 grams per day. So that is a little bit low. But I'm wondering though, urbanization is really happening quickly in Bangladesh. So I'm wondering which populations may benefit specifically from fortifying wheat flour, since it does seem really feasible to fortify. So I think I'll ask Dr. Mia if they know of any data on consumption patterns in the country that might help us understand who exactly would benefit from fortifying wheat flour. So finally, I'm wondering if Bangladesh, since it has mandatory oil and salt fortification, if they've bothered to evaluate those two programs. So I understand that GFDx also has a new visualization that compiles whether there's any information on health status changes before and after fortification of food. So I'm going to navigate over to program performance and then health status before and after fortification and availability of data. So when I click on oil and salt in the filters, and then again, search for Bangladesh, I see that in the case of Bangladesh, there's one pre-post comparison of median urinary iodine concentration It doesn't look like there's any data for vitamin A, so it doesn't look like they've looked at that health status change before and after fortification. I'm going to scroll down and look at this information also in the data view. And scrolling all the way to the right, I'm wondering what other information is available. I can see, according to the pre and post assessment sources that are listed there, there was a positive health change. So not just that they have data on a pre and post comparison, but that was a positive health change after fortification. So great, good to know. What I'm going to do is navigate back to the dashboard and download the PDF so I can send it to Dr. Maria before our meeting. And since I know she's a fluent Spanish speaker, when I share the GFDx website with her, I'll also let her know that all of this information, the exact same visualizations, are also available in Spanish and English. So she may be more comfortable looking at it on the Spanish site. Great. I'm going to hand it back over to Florencia to finish up the rest of the GFDx overview. Thank you, everyone.
Great, thank you so much. Okay, so here you can see our same website is actually in Spanish as well. So it has all the same information except in Spanish. So I'll get back to the PowerPoint presentation, and now we are going to move on to the question and answer session. So I'll hand it back over to Rebecca then.
Great, thank you so much. It was such a rich presentation. I know there's been a number of Q&A coming in real time, and it looks like Helena has been answering those. We welcome people to go ahead, and if you have a question you'd like to verbalize, feel free to just say in the chat that I have a question, and you could unmute. Otherwise, you can type the question into the chat. While we're waiting for any additional questions, I don't know if Helena or someone from your team would like to maybe, given the questions you see coming so far, highlight any certain points.
Thank you, Rebecca. Mark Myatt, thank you for your several questions. I would say one of Mark's initial questions has to do with a greater concept that goes beyond the GFDx, and it's how do we get high coverage for fortified foods? And there are several reasons why countries have high or low coverage of the fortified food, including whether or not fortification is voluntary or mandatory, whether or not monitoring is being done at all or being done well, and certainly how much is industrially processed and therefore easier to both fortify and to monitor. Rochelle asked if there was going to be any expansion of the GFDx to other foods, including sugar. And we're exploring those options, and we'd be interested in hearing what other foods might be of interest for us to put on the GFDx. And I believe that is the totality of the questions. Oh, another person asked if we were able to estimate fortification coverage for a micronutrient. And no, in terms of fortification coverage, we can only estimate for the food vehicle, not for the specific nutrient. A food like salt, which is only fortified with one nutrient, iodine, then you can, of course, say that that's the coverage for that nutrient. But for most other foods, we can only speak about coverage of foods per se. Thank you.
All right, any additional questions, please go ahead and type them. And again, we're happy to then have you speak up if you'd like to. Just indicate that you do have a question. Well, I have a question, which I'll pose. So it's really exciting. So it sounds like you have a process where every 2 years, like you said, you reach out to countries and countries provide that data. Just a couple questions there. Can you give us a sense maybe about your overall response rate? And you have many, many countries listed. Are you having a pretty good response rate and able to provide data, or are there certain areas where you're looking to find more data? And then maybe a second question about whether anything is done to validate the data that do come in those surveys every 2 years.
Hi, Rebecca. I can definitely help answer that. So we try to reach out to 196 countries. Our last survey round, we were able to find contacts for approximately 170, maybe 174, I can't remember exactly, but around 170 countries. Not all of them responded, but we got about a 30% response rate for English language countries. We also sent out the survey in French and in Spanish, and in our upcoming round, we'd also like to expand and translate the questionnaire into other languages such as Arabic and Chinese. So we hope that that will also improve our response rate. But in terms of English and Spanish and French, the response rates were approximately 30% each. There were definitely, as I'd mentioned, about 20 or so countries where we couldn't find any contacts for them. Many of them were small island countries. We didn't have a counterpart in the Ministry of Health or in a UN partner that could put us in touch with someone who might have this information. So definitely, if it would be helpful or of interest to others, we can circulate a number of countries where we would love to have contacts to reach out to and circulate the survey with. In terms of data validation, that's one of the activities. Vetting our data takes a long time. It takes about 6 months after we actually receive, initially send out all of the surveys, receive them, trickle them in. We clarify, we have a process where we clarify with the respondents what exactly they meant. And so the data validation does take some time to ensure that we understand if we're interpreting it correctly. Validating is something that we're currently in the process of doing with UNICEF through their NutriDash platform or survey tool. They do this survey every year, and they also ask some questions around fortification, specifically mandatory fortification, also monitoring protocols for salt. And so where we have some indicators that overlap with other partners, like UNICEF, and also we'd like to do this process with WHO, or we're validating the information that we have so that we can ensure that it's similar to what other partners are also collecting from the same countries. If any of our other partners on the GFDx want to expand on that, then I'd welcome them too as well.
Thank you, Becky. This is Helena. Just to complement that response, there are also some activities or information that we get from doing searches. So for example, the health impact studies, we did searches on PubMed, Google to find these studies, and then we extract the information ourselves. And because all of the organizations that are involved in the GFDx, we are actively involved in providing technical assistance to partners in countries. We get through work that our colleagues are doing, people send us documents. They'll say, hey, we know that this is coming, here's the document. And then we upload it, we vet it, and then we upload it into the GFDx. So our data are not updated once every 2 years. They're actually updated in real time on a regular basis. And so we'd encourage people who have a desire to learn more about a particular country or about a particular topic to come back fairly regularly, because we do get new information all the time. Thank you.
And if I can also add on that is, we do have the survey, we're moving to every other year, but GFDx is really relatively young, started in 2017. So we've only had 2 survey rounds, and we've learned a lot as we've initiated our first survey and now our second one. And with our second survey, we moved to a pre-populated survey in order to reduce the burden of responding for the recipients. And so now what they get is what the current information is on the GFDx. We actually send them the GFDx dashboard, which consolidates all the information for their country. And so each survey round is a little bit potentially of a validation as well, because it's going to several people, it's going to everyone in the country that we think is relevant. It's not just going to one single point. So there could be multiple people looking over the same information for their country, potentially flagging to us and saying, hey, we don't necessarily agree with that. Where did you get that information previously? Thanks.
Yeah, and this is Florencia. I just wanted to add that if we do have data on things like legislation or standards, we do require that there is the appropriate documentation available. So that's a government formal document with government stamp that we require we see and vet as well. So there's some data for which we require specific documentation to say whether or not it's there.
I also see that Boren asked a question, and it is, sorry, let me just navigate over. Is there a risk to overdose with vitamin A by using fortified foods such as oil? There are certain nutrients that have upper tolerable levels, so ideally individuals are not on a regular basis exceeding that upper tolerable level. And on the GFDx visualization, where there are nutrients with that level, you will see that graph indicating at what percentage of food, a fortified food, is contributing to that level. So a short answer is yes. If a food producer is adding 1,000% of your RDA or that upper level, then yes, you can overdose if they're fortifying improperly, if the standards in the country are inappropriate. It's the same as if you can overdose by supplementation. So that's why it's really important that I think countries have appropriate standards that are based off of the food consumption information in their country. How much oil are people actually consuming? They should develop standards that are based off of the levels that are in consumption, not consumption in another country, because it may not be accurate. Standards should also be based off of how much of that food is potentially the coverage in the country. Not everyone may be consuming oil in the country. So it is, but in many cases, countries are not seeking to fortify their oil to supplement levels or any food at supplement levels. It's really, a smaller proportion of the EAR or RDA that they're trying to meet. An example from the United States is when they've looked at from dietary intake information what the sources of folic acid was in the country based off of multiple sources of foods that were fortified. For example, breakfast cereals, which are voluntary, supplements, which people consume as they wish, and then also the mandatory fortification program, which it requires the fortification of breads and things like that, pastas. They found that it was really the supplements that were driving people exceeding the upper tolerable level, and also in some populations, the consumption of those voluntarily fortified breakfast cereals. So a very long answer, but I know that this is a question that people often ask, but if the standards are appropriate, then no, you should not be exceeding the intake for a nutrient. Does anyone else from the GFDx want to add to that?
I'm going to jump in. I'm going to pose one more question, if that's okay. So you gave such a wonderful example of a country use case today. And I was wondering, do you know anything about, this is, like you said, it's a very new platform. I can just imagine the amount of time it's taken to compile and make it incredibly user-friendly with so much information. And so curious about, who do you know maybe who is using the platform, and or do you have any plans to go out and maybe engage people in different groups? I know that this seminar is a great example of trying to reach, but would love to hear anything more about who might be using it or ways that you're planning on bringing people in to use it.
Yeah, that's a great question. In fact, one of the activities in this latest version of the GFDx for this year, we've included a series of in-country consultations. And we hold basically where IGN, FFI, and GAIN have country representation from our respective organizations. We've been able to link up with focus groups of fortification stakeholders to present the GFDx to them and to receive feedback from them about how they might use the GFDx in their own decision-making processes. So learning more about how we might leverage the data on the GFDx to better support countries using this platform in their decision-making. And so through those consultations, I mean, people have been incredibly excited about having all this data in one place, not only for their own purposes, but also for just comparing across countries. If they're interested in, and have started conversations, for instance, with the governments, it's a really useful tool for them to show data from another country who has maybe used a vehicle that they're interested in. There's a lot of resources for advocacy, so countries find that incredibly helpful. And just in terms of using this as a stepping stone for starting a discussion to bring people together around fortification, it has been really helpful. So those are a few of the bits of feedback that we've gotten so far. One of the things that we hope to do next is to create some sort of channel or space so that country stakeholders can share stories of either challenges or ways in which they've addressed these challenges, or for instance, if they've had to reassess a standard due to a new national policy, other countries might find that that example useful for their own purposes. And so some way of sharing this information of how other countries have dealt with issues. For instance, one of the big ones is food supply disruptions, particularly strengthening local premix supplies for fortification has been a real struggle due to COVID. And so a lot of countries have had to deal with this and are looking for resources on how other countries have addressed this barrier in premix supply. And then third, it would be really great if we could create some sort of contact or sort of network so that if a country stakeholder is in need of some guidance or in need of starting a program or policy process and would like to speak to an expert, that we are able to point them in the right direction. So some sort of hub or network for stakeholders, connecting them with experts either at an NGO, that would be really useful as well. That was one of the feedback points. So yeah, we have various dissemination events and specifically the in-country work that we're doing. And then I also wanted to say that we've done some analyses via, I think Helena or Michelle can speak to some of the statistics, but we've seen a variety of countries now using the GFDx. So through our website analytics, we're able to see new users and from which countries as well.
Thank you for that lead-in, Florencia. We've had 19,000 users in the past 3 years coming from 186 countries. And based on questions that we get, as well as who's citing our work, we know that people who are visiting are affiliated with non-governmental organizations, donor agencies, private companies, government offices, as well as research institutions.
It looks like we got one last question, which I think if we can keep the answer to about 3 minutes, we have time for. And I think it's a great one. Of course, I'm a little biased because it's a question that the work I'm involved is very interested in as well. So I'll hand it over to you all to take this last question.
I don't mind taking a first stab at it, and then other GFDx members can chime in. So EB's question is, based off of our experience, what advice do we have for individual countries that also want to develop a dashboard to visualize national, provincial, and district level data on such multi-sectoral programs such as reduction of stunting? So I definitely think there is a difference in terms of what GFDx is trying to achieve compared to if an individual country to develop a standard, but our biggest challenges so far have been really around usability. The GFDx, we're fortification technical experts. We are used to providing that TA on a very person-to-person basis, and we're not necessarily user design experts. And so that's, I think, been a really steep learning curve for us, is that, dumping all the data in one place is not necessarily the easiest way for people to interpret it, and then make conclusions on what kind of decisions that should be made for a program. So really being thoughtful about how to present information in a not just attractive, but clearly communicated way has been, I think, something that we've taken some time to learn, and we're still learning. So if there's any, as you're using the website, have suggestions on how to make something clearer to help users interpret it, then please send that information along. I'll pass off to other GFDx members if they want to add about their experiences.
This is Helena. The additional point that I would make is that this is a nonstop, forever and ever process of collecting the data, vetting it, putting it on the website, correcting it if there's a mistake, going back and forth. So you want to make sure that your institution is committed to this for the long term, because you don't want to make this huge investment and then in 2 years, you don't have resources to continue it anymore. Thanks.
Yeah, that's really great. And I'd chime in to Helena, is that not just the resource that you have to consider is not just your staff time to collect the information, populate, but for at least the website component, our web development has also been a huge resource that we've had to tap into. So that's a good thing to also consider. Over on my side.
Great. Well, thanks to you all. Those were great ending questions. I want to thank everyone, especially our speakers, Florencia and Becky, as well as their team members, including Helena, for a really wonderful presentation. And we want to thank you, the participants, for joining today's webinar. We really hope you enjoyed it. We hope that you will share it. Like we said, it's actually will be immediately posted to our YouTube channel, and we'll be following up on the Data for Nutrition site with a summary of a Q&A and other materials in the coming week. I do want to encourage everyone, this webinar platform is intended to be for the data community that cares about nutrition, or the nutrition community that cares about data. And we do welcome, if you have something that you would like to present and share, we do welcome. So please reach out if you'd be interested in developing a webinar around some work or concerns that you're involved with. Also, please check out the additional information about GFDx here on the slide. We'll also be, again, linking some follow-up on the Data for Nutrition platform. Thank you, everyone.